Concurrent disorder is kind of describing the normal process in mental challenges, because most people will have challenges like mood disorders or anxiety disorders or substance use disorders are not only having one problem, they come with several problems. And concurrent is very descriptive. It means, for instance, you not only have mood swings, or you not only have phobia or something like that, you're also using substances, or you have anxiety and mood disorder. So it's telling us that most people which are accessing the healthcare system have more than one problem. So the reason this concept of concurrent disorders or comorbidity was developed in the psychiatric classification was that this has a significant impact on how you should organize treatment and healthcare settings. And the consequence is you need to understand, or you're able to understand based on a good assessment, how possible concurrent disorders interfere with each other. I'll give you an example in a second. And also what appropriate treatment steps may be. Mm-hmm. So, for instance, mood disorder very often go along with heavy use of alcohol or benzodiazepines or other psychotropic substances also as a coping strategy. So that may become a problem on its own. And if you then want to, for instance, start a CBT or you start a antidepressant therapy, then you need to be aware of interactions with the substance use, and you need probably to develop a strategy to how to address substance use as well. If you also look into the consequences around suicide, for instance, substance use which is going together with depression has significant impact on your self-control, your impulse control, and on your suicidality. So, for instance, substance use is contributing to suicidality as much as depression does. So it's very important to understand the different things. And this is true also for other. As I said, they're very common. It depends very much where you're looking in terms of the population. If you look into a non-treatment population, so someone who is not in a hospital or in an emergency room or ongoing treatment somewhere, you find people with pure anxiety disorders or like just depression. The more you approach the system and the more you're involved with the healthcare system, the higher likelihood that people have mood challenges as well as, for instance, substance use challenges or similar problems. So you can estimate what the numbers are, but I think it's pretty much also related to the population we're looking into. And we know actually that depression, anxiety disorders, and substance use disorders are the most common mental conditions or mental challenges, and they all have a huge overlap between each other. Like any good assessment you should do in every interview. So if you're approached by a person in need, the point is really to try to assess the most likely areas of concern and do a good history. And what I would always recommend, if you see someone, to go through the most common areas. You can always miss something if you're not doing let's say a research assessment over 2 hours. But I would always ask for substance use, and I would always ask for anxiety symptoms, and whether clients have other specific concerns that they would like to share with me. So, and then you probably get 85 to 90% of the symptoms and of the syndromes you will need to address. Long waiting times for psychiatry, a very small number of specialists, and then beside that, it's very complicated if you live outside of a metropolitan area to access any help. In remote areas, there are no specialists or no trained mental health workers. So this is probably the availability of experts is than overall living situation is critical, but also the amount of stigma which mental health is facing. So for a lot of people, it takes quite some time to realize that they may need help or support, or would have a better quality of life if they would get support. For some, it takes years, up to a decade, from the first significant symptoms to access care. So a lot of barriers, unfortunately. We don't, as a society and also as a healthcare system, we are not making it easy for people which are suffering to get the help they deserve. Depends on stage of development. If there are really substantial concerns, I would definitely try to connect them to a good expert, which is quite a tough job, even in Vancouver. So it takes you, I think, more than half a year to see someone. What I would also recommend to connect with peers or with people with lived experience, because it's very important also to understand what the obstacles are and how to deal with them. Don't take it too personally. But definitely try to do something before things are escalating. And also what will become more and more important in the coming years is to develop web-related resources which help people to better understand the problems, but also maneuver the healthcare system, which is quite complicated. Even for a specialist, it's complicated, or a mental health expert, it's complicated to understand what's out there, what's needed, how to connect. And for patients, it's much more complicated. So, yeah, search the web, contact organizations like Mood Disorder Association or mental health organization advocacy, talk to peers, people with lived experiences, talk to your GP. Probably that's the first line of defense. I think it's important also. Concurrent disorders is a kind of an integrative category. It's a descriptive category. It's not really addressing. You could have a concurrent disorder with a psychotic illness and or even a severe mood challenges or anxiety disorder with substance has or trauma and depression, different consequences, different approaches. So there's not one fits all. But I would really, as mentioned, suggest to try to better understand your own problem. And then I'm very helpful is to talk to people which are gone through some of those developments already. So, or even family members are very good initiatives in British Columbia which could help you. And then probably my first thing would be, if I'm kind of clear I need help, I probably first access point would be the primary care physician, and who have hopefully helps you to connect to a psychiatrist or a mental health institution. Yeah, a general take-home message. I think we're making it far too complicated for people to get the kind of support they need. I think we have a high threshold system, and we need to rethink our approaches because we're producing chronic cases. If you wait 10 years, for instance, what's the average for substance use, from the first symptom to the first professional intervention or help, you already have a kind of a chronic situation. We need to interfere and provide support much earlier, much easier. And then in the end, we would probably save money. Second take-home message is mental health and addiction is the most underfunded area in healthcare. Far less than cancer or heart and lung. That has to do with an ongoing discrimination for those. And I think mood disorder organization or academics or people with lived experience, we need to join there on the topic of fighting stigma and this amount of discrimination, because it has the same harmful consequences than other medical conditions.